Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position. All right. For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. All right. So when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion, and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. All right. Now, in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself, and may also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range, and you perform the test within their available range that they have. All right. Today we're going to be doing MMT, that's manual muscle testing for knee flexion. All right. So we're going to be just checking out the hamstring group of muscles because that is the primary muscle group for knee flexion. So join me. I'm just going to go through these grades with you. I'm going to go from grades 5 to 0, all right, and show what it looks like with regards to the patient's body positioning in relation to the examiner's body positioning and the hand placement. The hand I'll be doing the test and the hand for stabilization. All right, so here we have it. We have the patient lying prone. So the starting position for knee flexion is in prone lying, okay, and ideally the examiner will be on the side of the testing limb. Because for purposes of this video, I'm going to show you this will be the testing limb, so we're going to be testing this side, and also that the patient must wear or should wear, shorts or tights so you can properly see the muscle or the area being tested, okay? Now, I'm going to go ahead and perform this for you and let you know what it looks like. For grade 5, what you want to do is just make sure, I would want you to go ahead and flex or bend this knee for me. Bend this knee all the way up like you're bringing the heel to the butt. Okay, so we can see that she has good range of motion there. She's able to bend the knee, bring the heel to close enough to the butt. And now that she has this range, I'm going to stop it at any range. All right. So the stabilizing hand rather, will be stabilizing the thigh, while the testing hand will be providing the resistance, by the leg or distal leg, almost close enough to the ankle. Okay. Now, if you're close enough to the limb, you can do the same thing for that side. The testing hand, you want to make sure that you're stabilized with the stabilizing hand, and you're going to provide the test. And the instruction that you're going to give is hold it in this position, don't ever pull it out. Keep it there, keep it tight, lock it in, don't ever pull it out, don't ever pull it out. Don't ever pull it out. Okay, fine. So that would be a grade 5. And of course, you know, a grade 4 is if she breaks form on the maximal resistance, or if she's able to hold it under moderate resistance. That's a grade 4. A grade 3 will be, go ahead and just bend this knee for me. I'm still palpating, feeling the muscle work, and she's able to lift that limb against gravity alone. That is for grade 3. Okay? So you want to make sure that you're palpating the muscle belly while she's performing the movement, so you can feel the activity going on, and also that you can also see visibly. You can see the muscle contracting, right, as she bends that knee. Now, I'm going to go ahead and show you from grades 2 to 0 short. Alright, so I'm sure now you can see the change in this position here. Whereas for grades 5 to 3 she was prone, now we have her in sideline because we want to put her in a gravity minimized or a gravity reduced position. So the gravity reduced position for knee flexion is in sideline, okay? And that is the position I'm going to put her in for the test for grade 2, right? So what we're going to be doing is the side that she's lying on, she's going to bend the bottom knee for a little bit of stability and support. I'm going to go ahead, the examiner stands behind the patient, right? He supports the limb with one hand, and the other hand, what he's going to do is go ahead and give the instruction, go ahead and bend this knee forward, bend it back, and he assists, right? So he supports that limb there while the patient is performing the movement, okay? So this is a gravity minimized position. Let's say that she wasn't able to perform a grade 3 against gravity, so put her in this position to see if she's able to accomplish it. And seeing that she can accomplish the movement in this position, she'll be a grade 2 out of 5 MMT for knee flexion, okay? Alright, so let's say that in grade 2, she wasn't able to perform the movement. So something is up, so it's either 1 or 0. So put the patient back in prone, so the patient is lying, belly down, and we're going to look and also palpate for any muscle activity going on when we give that instruction to bend the knee. So this is from grades 1 to 0. Grade 0 is if I say, go ahead and try and bend the knee, and she's trying to bend that knee, but there's nothing happening. I'm not seeing anything happening, I'm not palpating anything happening, there's no movement whatsoever in that limb. That would be a grade 0. However, if I do say, go ahead and try and bend that knee, and she's making an attempt, there's no movement occurring in the limb. However, I can see and I do feel some muscle contraction going on with a hamstring group of muscles, and that will suggest that that will be a grade 1 out of 5 for MMT knee flexion. Okay, grade 1 out of 5 for MMT knee flexion. So there you have it. That is MMT testing, minor muscle testing for knee flexion.